Our motivation for holding this event tonight is to provide information and hopefully a sense of clarity about options for all of you here. And I imagine that the fact that this isn't spoken about very freely really causes terrible isolation to those of you who have had some exposure to pelvic mesh and are having difficulty dealing with what has happened. Our first speaker tonight is my colleague Cathy Lyons. Cathy's training and education is in the area of nursing. She's a registered nurse and she's employed at the firm as an in-house nurse. Her nursing experience has been in the areas of surgery, intensive care, anaesthesia and recovery. Cathy's role is twofold. She's the point of first contact for anybody who rings in and makes contact about a health or medical law claim, and she also undertakes clinical reviews of cases for the health lawyers at the firm. In both aspects of her role, Cathy sees her aim as to help clients who want to gain a better understanding of their medical history, which is what I imagine a lot of you are wanting to struggle with on a daily basis. Cathy's talk tonight provides the introduction to pelvic mesh, what it is, why it's used, how mesh products have evolved over the years. So would you please welcome Cathy Lyons.
Thank you everyone, and it's great to see so many people here this afternoon. Due to wonderful journalists like Joanne, who will be talking later, there has been a lot of media, a lot of mesh related things in the media lately, and it can be quite a confusing topic. If you haven't been involved with mesh either personally or professionally, it can be quite confusing. And it's made even more confusing by the fact that they use different terms to describe mesh. You might know it as tape or a sling or an implant, and some people do actually refer to it as mesh as well. So what is mesh? So surgical mesh is a loosely woven sheet that is used to provide support when repairing weakened or damaged tissue. So most surgical mesh devices are made from a synthetic fabric, or they can be made from animal products as well. So then the body's own tissue develops in and around the mesh products, as you can see up here, not so clearly, and then that provides a supportive framework. So mesh was first used in around the 1940s, and it was initially used for repair of inguinal or lower abdominal hernias. It then progressed on to be commonplace being used in abdominal hernias as well. So it wasn't actually until the late 1990s that they first used it for gynecological procedures. And the first procedure that they used it for was stress incontinence. So just a bit of a recap on what stress incontinence is. So stress incontinence is a condition most commonly occurring in women, lucky us, in which there is an involuntary emission of urine when pressure within the abdomen increases. So it could be from coughing or laughing or jumping, and so then obviously women wanted to try to rectify this issue if they could. So what they came up with was a U-shaped mesh, and that was placed under the urethra, which is the tube that passes urine out of the bladder. And they used the mesh to lift the urethra up, to put it back in its normal position, and that normal position then provided tension on the urethra and stopped the, or helped stop the incontinence that the women were experiencing. This is actually courtesy of the Newcastle Herald, and this shows a number of different types of mesh. It's probably not that easy to see, unfortunately. And if you can see here, there's these little anchor points where they would use are used to fix the mesh inside the body. So by 2002, the mid-urethral sling, which is what that U-shaped mesh is called, was the most common procedure used to fix stress incontinence in Australia. And this worked for some women. So following the perceived success, and I say perceived because it didn't work for all women, so following the perceived success of the sling tape in stress incontinence, additional mesh products were manufactured to treat pelvic organ prolapse or vaginal prolapse. It affects about 40% of adult women, so it's quite a huge problem. And it involves the pushing of nearby structures, so your bladder, uterus, and rectum or bowel, down into the vagina. And this occurs as a result of weakened vaginal structure, and that can be following childbirth, obesity, or other factors. And so when people experience prolapse, pelvic organ prolapse, it can be a variety of different symptoms. So some people may just have a pushing down sensation. Some people may actually feel and see a bulging in the area. Some people may have discomfort during sexual intercourse. And some people might experiencing a variety of urine problems, whether it's incontinence or even retention, not being able to pass urine when you want to. And some people actually don't have any symptoms at all, so they can actually have this condition and live quite happily with it. So just as a bit of a visual here, in the top top left-hand corner, that's the normal anatomy, what we're all hoping for. This one here is a bladder prolapse, so you can see here that it's pushing against the weakened vaginal wall and pushing that, having that downward feeling or sensation. Over here, there's the back passage or back passage prolapse or the rectus seal, and that's obviously the bowel pushing against the weakened vaginal wall. Or we have the uterine prolapse, where that's the uterine falling down due to that loss of structure and support from the vaginal support tissues and ligaments. So people have been diagnosed with a prolapse of some type, and then they wanted to have it repaired for obvious reasons. So this is where they came in with the mesh. And as you can see there, that's the type of mesh, or one of the types of mesh that they would use for pelvic organ prolapse. So how do they do it? So through small incisions in the vaginal wall, surgical mesh is implanted into spaces or compartments in the pelvis using the specially designed instruments. And once they've got it in there, they use special fixators or sutures, and we saw the little fixators in the previous slide, the little arrow-shaped devices, and that holds it in place. And as we said before, the body's tissues and cells grow around the mesh, and that forms the structure, provides the support from the mesh being implanted. So while the manufacturers were rubbing their hands together due to the increased popularity of mesh products, some women were having success from these implants, and some women really weren't. They were starting to experience real problems, ranging from mild to totally life-changing. And some of the reports that we've had from women who have contacted us include infection, erosion of the mesh into the vagina, and which actually can be felt or seen by the appropriate people, bleeding, recurrence of prolapse, so the very reason that you're having the operation in the first place has failed, urinary problems ranging from incontinence through to retention, so not being able to go to the toilet when you need to or want to, bowel, bladder and blood vessel perforation, so the mesh actually intrudes into your vessels or your organs, causing injury to nearby organs, pain during sexual intercourse, pelvic pain, which can be debilitating for some women, and extrusion of the mesh device, actually the mesh protruding out through various organs and vessels. So as a result of those, and not even conclusive list of problems that people experience, many women have obviously gone on to have these complications rectified. Some of them have gone on to have surgery to try and remove the mesh, which isn't always successful, and sometimes they might have operations to try and oversew where the mesh has protruded through. So these operations have, as you can imagine, varying degrees of success. For some women, the pain becomes totally unbearable, impacting on every aspect of their lives. Women have told us that they wish that they had been more informed. Had they known what the potential complications would be for having this operation, that they may very well have chosen not to have it in the first place. They have also told us that the pain or the symptoms or the problems that they were having prior to the surgery pale in comparison to what they now have to experience. So, which leads us on to the goal for tonight. So the goal for tonight is to, as Catherine said, is to share the information with you, to share what complications can arise from mesh implants. And if everyone in this room leaves and goes and tells one other person, and then they in turn go and tell one other person, then we're helping to spread the word and helping women to be informed and helping them to make the right choices for their bodies. Thank you.